Hello everybody, and welcome to the Thursday edition of Video Clips. And just a couple of announcements. The first thing is next week I'm starting the next series for those who want to be food over medicine coaches and possibly open food over medicine chapters. I am really excited about this idea because we've always felt like we should have a local presence every place that we could. And so I'd love to see groups congregating that are tied to our company for support and programming and all that sort of thing. So if you're interested in that, send me an email. And of course, I always want to keep those career emails coming because I really think training health professionals and people who want to be health professionals is a big part of solving this healthcare mess that we're in at this point in time. And of course, free membership gives you an opportunity to check out some of our articles and recipes and participate in a conversations with Pam session with me, and also have a conversation with one of our staff here. We have a great nurse, dietitian, pharmacist, lots of great people here who can talk to you about some of what you want to accomplish in health, either as a consumer who wants to improve their health or as a health professional, and give you some direction. So pampopper@msn.com, that's the email. So keep those emails coming for all the cool stuff that we do here, all right? So I want to talk about exercise and diet and blood pressure. And what happened is I read an analysis, which I'll share with you the results of, and then one thing led to another, and I ended up writing this paper that has 23 references. And let me see what else I can find on this topic. So the analysis that I read, is just in a news feed that I get, showed that exercise is just as effective as medication for lowering blood pressure for some populations, and almost as effective as medications for others. In other words, there are a lot of side effects of medications, and if you really read them, and maybe I'll do a video clip about that next week just to follow up on this, but I think that reading the list of side effects for blood pressure meds could make you really get excited about exercising instead of taking the medications. So this particular analysis was pretty large because it included 391 randomized controlled trials. 197 of them evaluated the effect of exercise, and 194 evaluated the efficacy of medications. In all populations, medications and exercise were effective in lowering systolic blood pressure as compared to controls. There was a slight advantage for medication, an overall greater reduction of 3.96 points in systolic pressure, but the researchers stated that for most medications, when you took out the pooled analysis, the exercise was just about as effective as drugs. There was no real difference between drugs and resistance training, or a combination of endurance and resistance training. All types of exercise were effective, but the best came when there was both endurance and resistance training. So I started looking into what else could I find, and the first study that I could find showing that exercise could prevent hypertension or lower blood pressure and physical activity was published in 1968. It was a study that included only men, and it reported that men who exercised more than 5 hours a week had a lower risk of developing hypertension later in life. And one thing, I'm an advocate for 5 or 6 days a week of exercise. We're talking about 5 hours here. A lot of the studies that I found people didn't have to do very much to get the effect, and it was dose dependent, which I'll explain in a minute. So you don't have to be out running marathons and entering bodybuilding competitions in order to really improve your health. A prospective study looked at the relationship between aerobic fitness and hypertension and showed that subjects who lost cardiorespiratory fitness had an increased risk of hypertension, while those who showed gains in fitness levels had a lower risk. Another similar study showed exactly the same result. For those already identified as being at risk of developing hypertension, engaging in aerobic exercise reduced systolic pressure by 4.3 points and diastolic pressure by 1.7 points. Both hypertensive and non-hypertensive individuals engaging in aerobic exercise just 2 days a week, again, not training for a marathon, experienced reductions in blood pressure, and a pooled analysis of 28 randomized controlled trials showed that resistance training lowered both systolic and diastolic blood pressure by 3.9 points. An analysis of 12 studies showed that physical activity had a positive effect on blood pressure, and 7 of those studies showed that the effect was dose-dependent. More exercise equaled lower blood pressure, bigger drops in blood pressure. A study of Australian women showed exactly the same thing. More was better. both in terms of lowering the risk of developing hypertension and for lowering blood pressure overall. Studies of both runners and walkers, again, you don't have to do anything particularly aggressive, show that more exercise is better not only for preventing hypertension, but also for preventing hypercholesterolemia, diabetes, and coronary heart disease. So one of the things I like is talking about things where you do one thing and it has an effect on many things, rather than the way medicine is set up. You take a drug to deal with this particular biomarker or symptom, and it not only doesn't affect anything else in a positive way, it causes negative side effects. Exercise, totally different. No negative side effects other than people complaining about the fact that they don't want to do it. So I think the fact that I was able to find so many studies where the dose-dependent effect, that always strengthens the association, in this case between exercise and blood pressure. Well, not shockingly, diet has a profound effect on the prevention of hypertension and on reducing blood pressure in patients who are already hypertensive. Like exercise, the effect of plants on lowering blood pressure is dose-dependent. So, for example, the Adventist Health Study 2 compared habitual vegans, lacto-ovo-vegetarians, and non-vegetarians, and showed that the lacto-ovo-vegetarians and vegans were better off than the non-vegetarians, and then the vegan group was better off than the lacto-ovo-vegetarians. So as you move up the scale of eating more and more plants, things get better and better. In a prospective study of over 1,500 people who didn't have hypertension at baseline, those who ate more plant foods had a lower risk of developing high blood pressure. Another similar study showed that 34% vegetarians had a 34% lower risk of developing hypertension than people who were not vegetarian. A study compared the blood pressure of sedentary vegans, endurance athletes eating a standard American diet and running 48 miles per week, and sedentary people consuming a Western diet, and the sedentary vegans were better off than both groups. And I think this is really interesting. I'm not saying this because I think it's a good idea to eat a vegan diet and sit. What I am saying is that a person eating a standard American diet and running, who's an endurance athlete running 48 miles a week, which is quite a bit, is still at high risk of bad things happening. Athletes often have the illusion, because they look good on the outside, of thinking that they're really healthy on the inside, and that's not the case. Some of you remember I did a video on Bob Harper's situation, looked great on the outside, had a heart attack, blood vessels not doing so well on the inside. Now this is really interesting. The DASH study, Dietary Approaches to Stop Hypertension, was the first randomized controlled trial that looked at diet and blood pressure. And in this study, subjects were randomized to one of three eating plans: a controlled diet, standard American, the DASH diet, which was high in fruits and vegetables and low in saturated and total fat, and then a diet similar to the controlled diet, but where the patients were just instructed to eat more fruits and vegetables. Sodium intake, and this is one of the reasons I wanted to cover this study, was similar for all three groups. Those eating the DASH diet experienced a 5.5-point drop in systolic blood pressure and a 3-point drop in diastolic pressure. The group eating more fruits and vegetables experienced a slight drop in blood pressure, but it was really not as good as those eating the DASH diet, which was really a pretty plant-based diet, all things considered. Additional research showed that higher fruit intake was not only associated with lower blood pressure, but also lower glucose levels, and that 3 servings of whole grains daily lowered blood pressure. Now, unfortunately, the thing that the DASH study became most famous for was telling people that restricting salt would lower your blood pressure. But the interesting thing is the salt intake remained stable in all three groups and could not be responsible for the lowering of the blood pressure. So this was, I've done a lot of research on this, and it seems that this DASH study was the beginning of the salt restriction, preaching salt restriction, and that's not what the study says at all. That's a different topic for a different day. There are videos posted on this channel right now that address this issue, and I think I've written 10 or 12 articles that are posted in the Health Briefs library as well. Another study, Coronary Artery Risk Development in Young Adults, or CARDIA study, followed 5,115 young men and women over a 15-year period. A subset of 4,300 plus patients was analyzed for the effect of diet on blood pressure and showed a dose-dependent positive effect for eating more fruits, vegetables, whole grains, and nuts on blood pressure. The study also showed the opposite was true. Eating more red meat and more processed meat was associated with higher blood pressure. Many other studies have found that higher intake of animal foods, including poultry and seafood, resulted in higher blood pressure. Now, most people think, or many people think, that seafood promotes better cardiovascular health, but prospective studies show that it either increases blood pressure or has no effect. But I could not really find anything that clearly showed that eating seafood lowers blood pressure. The EIC study, which stands for European Prospective Investigation, EPIC study, European Prospective Investigation into Cancer and Nutrition, Oxford study, reported that vegans have lower blood pressure than meat eaters, fish eaters, and vegetarians. So again, you see that dose-dependent effect, the vegan eating more plant food than these other groups and being better off than the vegetarians. Yet another study in which subjects were encouraged to adopt a plant-based diet as part of a health improvement program for either 7 days or 30 days, both groups ended up with lower blood pressure. And not only is this dose dependent, but look at how fast it works. 7 days is not a long time to be on a health improvement program, and people were able to lower their blood pressure nonetheless. Medicated hypertensive patients who change their diet and exercise patterns can not only lower their blood pressure, but can often reduce or totally eliminate their medication. One study, including 26 patients taking medication for blood pressure, showed that after 1 year of eating a vegan diet, all of them had lower blood pressure, and 20 out of the 26 were able to completely discontinue their medication. We see that here all the time, and I get emails from people all the time who say, I've watched your YouTube channel, or I saw one of the films you're in, like Diet Fiction or Food Choices or something like that, and after that it inspired me to change my diet. I'm off my blood pressure meds, I'm off my diabetes meds, I'm off my cholesterol meds, and of course don't stop taking your meds until you change your diet and you work with somebody who knows what they're doing. But the point is that it's a really consistent story that when people change their habits, their health changes and their medication changes. And again, you could become very motivated to do this by just looking up the drugs you're taking online and looking at the side effects and saying, wow, because there are no negative side effects to eating fruits and vegetables and walking and running and going to the gym or whatever else you might want to do for exercise. Now, I want to make it really clear that there are some people who benefit from medication. And if we just medicated and performed surgery and did things in the medical field for the people who really qualify and benefit, oh my gosh, the bill would be well under $1 trillion and we'd stop hurting people. Unfortunately, there's no money in that. So we really have to expand the audience of people who need these types of services. And so many people are medicated who, first of all, aren't candidates for medication for hypertension or could easily make some changes and lower their blood pressure to the place where they don't need medication. Now, one of the reasons why I wanted to cover this when this first study caught my attention is that the guidelines have changed and the threshold for medicating people has come down quite a bit. So starting last year or even the year before, more and more people are being told that they should be medicated for high blood pressure who would not have been candidates before. So I think this is a good time to pay attention to it, because for those of you who are what we would term high normal hypertensives, a few weeks of good eating and exercise, a little bit of weight loss, and getting yourself hydrated may just take care of it, and you won't have to take meds, and you don't have to deal with the side effects. So that's all for today and all for the week. Hit the subscribe button. We're going for 25,000 subscribers now. As always, pass this on to anybody who you think would enjoy watching it, and I'll be back to you next week with more news.